So the process for a single woman coming to the clinic would be, first of all, they'd come and see a consultant. That consultant would run a number of tests on them, make sure that they have sufficient ovarian reserve for their treatment, form a treatment plan with the patient based on the outcome of those tests. And then they get to perhaps what's the exciting part, which is donor selection. We work with a couple of sperm banks, one in the United States and one in Denmark. Patients then go online, they take a look at these donors' profiles, they select 5 of their preferred donors, and then they submit those submissions back to SIMS. For some women though, they prefer not to do that and they prefer SIMS to pick a donor for them. So they would pick selected characteristics, so they'll pick preferred hair colour, eye colour, height, characteristics that they would prefer, and we can pick a donor for them if they're not comfortable going and picking the donors. It can sometimes be a little bit daunting to go online and see 200 donors at a time. It's very difficult, sometimes you get hung up on little things that aren't important, so they prefer us to pick a donor for them. But for 95% of women, they enjoy the experience, they want to go on. The donors have extended profiles, most have photos, they have pages about their likes, their dislikes, their favourite memories as a child, their favourite things, their family histories, and there's a little bit of excitement there in picking that donor. In fact, some women get together, some of the patients get together and have donor parties where they compare the donors, they pick the donors together in groups and look at the donors together and find their favourites. It's one of the most rewarding jobs you can do. It's one of the most difficult, it's one of the most challenging, but the outcomes at the end are the best. Obviously, seeing somebody come back to the clinic who have struggled to have a child and who've now got that baby, their dream child, is one of the most rewarding things. But sometimes the pathway for those patients isn't the easiest. Sometimes it is a difficult journey. For the single mums, it tends to be slightly easier in that the missing part of that puzzle is usually the sperm, and we can provide that sperm donor. For a lot of them, it's quite a straightforward process, but there are some where there are other medical reasons why they can't get pregnant as well, and we only discover that as we go through the process. But it is a rewarding and an exceptionally fun and challenging but great time working here at SIMS.